The birth control patch looks like a small, square beige Band-Aid. You can stick it on your skin, and it releases a combination of the hormones estrogen and progestin to prevent pregnancy. The patch doesn't protect against sexually transmitted diseases. It's a transdermal form of hormones. Here's what else I tell my patients about using the patch for birth control. The patch prevents pregnancy the same way that birth control pills do. The hormones in the patch prevent your ovaries from releasing eggs, so you don't ovulate. The hormones also thicken your cervical mucus, which makes it harder for sperm to enter the uterus and fertilize the egg. You don't have to think about it every day like the pill. Unlike pills you have to take every day, you only have to change your patch once a week for 3 weeks. During the 4th week, you don't apply a new patch, and that's when you get your period. You can put the patch on your upper outer arm, belly, butt cheeks, or back, but not on your breasts. The patch is 91% effective at preventing pregnancy. When used correctly, that number jumps to 99%, but with typical use, the pregnancy protection is a little lower. That's because it might be easier to forget to change your patch on time. It's key to stick with the same patch change day every week. Make sure it doesn't fall off. The patch falls off only about 5% of the time, but this is the main reason I find that some women have issues with the patch. There are things you can do to prevent this. The patch can get wet, but you shouldn't use lotions or creams near it because they can loosen the adhesive. The birth control hormones are actually in the adhesive of the patch, so if it comes loose, you have to try to stick it back on or replace it with the new one. The patch may be less effective in overweight women. If you weigh more than 198 pounds, talk to your doctor about the best birth control option for you. The patch has a higher risk of deep venous thrombosis than other birth control. The overall risk is still quite low and much lower than the risk of DVT during pregnancy. But if you have other risk factors for DVT, you should talk to your doctor about the best birth control option for you. The patch has similar benefits as other hormonal birth control. It can make your periods lighter and less painful, reduce acne, and reduce the risk of certain cancers. But the hormones in the patch can have side effects too. These include skin irritation near the patch, breast tenderness, headache, and breakthrough bleeding. Like other birth control that contains estrogen, the patch may not be safe if you have certain health issues such as blood clots, high blood pressure, breast cancer, or serious migraines. So, let's recap. The patch is 91% effective at preventing pregnancy. You change it once a week. You need a prescription. The patch does not protect you from sexually transmitted diseases.